All right, so we are going to get started. Thank you to everybody who is tuning in for yet another EBFA webinar. My name is Dr. Emily Splichal. I am the founder of EBFA. I'm also a podiatrist in New York City, human movement specialist, and creator of all the Barefoot programming through the Evidence-Based Fitness Academy. If this is your first time tuning in for an EBFA webinar, welcome. And obviously, welcome to everybody else. I see some familiar names, which is very exciting to see repeat listeners and supporters. And we have some listeners from other countries, including Asia and Australia and Europe as well. So that's very exciting. All of our webinars are always recorded, they're archived, and they can be found on our YouTube channel, which is youtube.com/EBFA Fitness. And we offer webinars for free first or second Thursday of every month, and also have some CEC webinars so that you can get those credits. Okay, we are going to run through the webinar and then we'll do some Q&A at the end. So if you have any questions, just type those in. There's a question area and then we'll go over those at the end. And I think that is it. So we're going to get started. We are doing Run Injury Free, which is all about activating the innate loading response. And this is based off of a workshop that I did at the NorCal Fitness Summit. And it also has to do with a lot of the science behind EBFA's programming. And it really is the basis of what I spend my day talking to all of my patients about, or at least my patients who are runners, on how they can reduce their injury risk. So, a very exciting topic. Run injury free. So, put the little question mark in there because really we kind of have to ask ourselves, can you run injury free? I think it's a big question mark. I don't really think that we are completely designed to be running such long distances, and it's really evident based off of the injury rate. So there are averaging 70% of runners getting injured. I've even read some studies that have seen as high as an 80% injury risk. And so again, that kind of supports, really are we designed for running, so we're defying physics pretty much. 90% of these injuries are overuse related. So these are going to be all of our plantar fasciitis, Achilles tendonitis, shin splints, runner's knee, patellofemoral pain, IT band syndrome. A lot of these stress fractures, add that in there. All of these have to do with what is called overuse injuries. And when we say overuse, we kind of need to ask ourselves why, or what does that mean? Well, understanding what an overuse injury is and why 70 to 80% of runners are getting injured really has to do with impact forces and those ground reaction forces that are coming through the body with each step that our runner is taking. Understanding the difference between walking and running is extremely important. Obviously, there are similar yet different demands that are placed on the body when you compare walking and running. Some of those most notable differences has to do with the impact forces. So when we walk, we have 1 to 1.5 times our body weight in impact forces going through our body. If we pick up that pace and we start running, obviously it's going to increase. So now we are sitting at more of a 3 to 4 times our body weight in impact forces. The faster you go, the higher those impact forces are going to be. Another difference between walking and running is what's called flight time. So this means that there's a point when we are running where there is nothing on the ground. So we are floating or flying. Last difference is that there is what's called double limb support. So that means that everything that is occurring while we are running is happening on a single leg. So that means that all of our runners' deceleration and absorption of those impact forces is happening on one leg. Forces are going to go up, pressure is going to go up, and the demands placed on the body are obviously going to go up. So why are our runners getting injured? Why are your patients or your clients or your athletes getting plantar fasciitis, Achilles tendonitis, stress fractures, runner's knee, etc.? Again, it has to do with the impact forces, but it's a little bit more than just saying high impact forces, don't run, change your shoes, right? There's more reason behind it. And it's a reason that's still questioned today, which is why still we have 70% of runners and why there's so much research going on about reducing running related injuries. This is the way that I approach my patients and my runners, and I see great results. It's evidence-based, and it looks past just changing the footwear, which is, I think we have to do a little bit more than just changing the footwear and changing the strike pattern. So when I have a patient come in, they're a runner, they're getting injured, I'm looking at 3 different reasons of why they're getting injured. One is either there is a delay in the way or the rate at which they're responding to those impact forces. Are they not activating their deceleration response or their loading response early enough? Okay, that's the first reason that I'm looking at. Second reason is, are they activating the loading response fast enough, but they cannot control that loading response? It's another reason that I'll look at injury. And then the final one would be, are they activating it soon enough? Are they controlling it? But then they're fatiguing that control or the ability to store those impact forces. So those are really the 3 big reasons that I look at runners getting injured. One that we're going to focus on today in this webinar is the delay in responding to those impact forces, and it has to do with the innate loading response. So why is there a delay? Why are our runners not initiating that loading response fast enough? Well, it really has to do with the shoes. So our shoes are blocking our ability to initiate that loading response fast enough. And what happens when we put on those shoes? Why do those shoes delay our loading response? Well, this is the basis of all of our education programs through EBFA, is that our footwear blocks the plantar's skin. And the skin on the bottom of the foot is very unique in the sense that it has small nerves with very unique receptors, and these receptors are responsive to skin stretch, texture, deep pressure, vibration, light touch. Once you put on those shoes, once you put on socks, once you stand on certain surfaces, you're going to start blocking and dampening these mechanoceptors, which again are small nerve receptors. The one that we specifically want to pay attention to, which has to do with impact forces and running related injuries, is the one that detects vibration. So it would be this Pacinian corpuscle, a very specific receptor on the bottom of the foot, and it detects vibration. Our body detects impact forces as vibrations. So it's not pressure, it's not skin stretch, it is the vibration and the hertz of that vibration. So if you start to dampen or you block that Pacinian corpuscle, it's going to alter the perception of that vibration. And that vibration leads to what is called the innate loading response. So step 1 is stimulate the skin on the bottom of the foot so it vibrates that Pacinian corpuscle. And then you stimulate the innate loading response. Our innate loading response contains 2 specific responses. First response is the top picture, and that is what's called the flexion response. So one of our body's innate loading responses is called flexion response. And this is evident before we're even walking. If you take a baby before they're walking and you kind of walk them around and you stimulate the skin on the bottom of the foot, they do what is called a flexion response. They're going to pick up the foot and it's going to mimic like they are walking. That is pre-programmed in our motor system. And what's driving that baby to flex the knee and kind of retract up is the stimulation on the skin on the bottom of the foot. That research is based off of Robbins et al. So if you are not familiar with Robbins, I highly recommend checking out his research. All of his research is available online, which is wonderful. So you can read the full research article. It's not just the abstract on PubMed or whatnot. His website is www.StephenRobbins.com. So StephenRobbinsMD.com. Great research. a lot of his research is based around this innate loading response and that flexion response with plantar skin stimulation. The second response that Robbins, again, has done a lot of research around is the bottom picture here, which I know the picture is showing a Babinski sign or a Babinski test, but really what it's showing is if you stimulate the skin on the bottom of the foot, what you do is you drive an intrinsic muscle contraction, and that's part of your innate loading response. So our steps that are happening is you stimulate the skin on the bottom of the foot. That vibration from the impact forces stimulates the Pacinian corpuscle, which then drives intrinsic muscle contraction, and it drives at the same time that flexion response. If you put on your shoes and if you block the vibration and the plantar skin, now you do not have that reflex type reaction happening. Any delay is going to increase the impact forces. So what this innate loading response, yes, it stimulates the intrinsic muscles, and yes, it stimulates that flexion response. So we're going to go to that flexion response a little bit more, because part of our innate loading response is that your foot and your hip are deeply integrated, which means you are driving the loading response from the floor to the core. And that's what we're going to talk about. That is what's called reflexive stability. If you've taken any of my workshops or you've listened to any of the webinars, you know that what we talk about is getting our foot and our core to speak together, to act like a reflex, which means the millisecond that you contact that ground, your hip is already active and stable. So what is this reflexive stability? Obviously, it's going to be driven from those intrinsic muscles. The exercise that we always reference, if I could hear you guys, I'm sure you'd be saying short foot, right? We know that it is short foot. Short foot has been shown to drive deep hip activation. When you do short foot, you are targeting specifically the abductor hallucis. That abductor hallucis does many things that are very critical to your innate loading response, reflexive stability, and decreasing your runner's injury risk. When you activate short foot, your abductor hallucis, one, abducts, which makes sense. That's why it's called that. Two is that it picks up your navicular, so it increases the arch. And if you've ever done short foot, or if you've never done short foot, I encourage you to either go to the EBFA site under the blog or go to YouTube and catch some videos on how to do short foot. But when you do short foot, you will notice that your arch picks up. The reason that your arch picks up is because of two reasons. One, your abductor hallucis picks up your navicular bone, so it acts like a little bit of a stirrup on that bone. Second reason that you notice your arch picking up is that when you engage the abductor hallucis, because it attaches to your calcaneus, it actually pulls your subtalar joint into inversion. So there's an inversion moment created when you activate that abductor hallucis. Both picking up the navicular and driving the subtalar joint into inversion are going together see that increase in the arch. The fourth thing that your abductor hallucis does is that there's research that has shown that when you stimulate the abductor hallucis, you get a reflexive co-activation of your deep six stabilizers. These deep six stabilizers act like the rotator cuff of your shoulder. And what they do is they suction the femoral head back into the socket, creating stability. And then it continues. When you create stability in the hip, these deep six muscles are myofascially connected to your pelvic floor, which we know is critical to proper hip or anterior hip function. Your pelvic floor is connected to your diaphragm on top, myofascially connected to that is going to be your psoas. Now your hip is stable. And if we're thinking about a runner, everything is in a single leg stance. They are decelerating and accelerating in a single leg stance, which means hip stability is critical to the way that that runner is going to decelerate and absorb those impact forces. So you really do need your foot and your hip to be integrated like a reflex. And what drives it is going to be intrinsic activation. What drives intrinsic activation is going to be stimulation of the skin on the bottom of the foot, namely the Pacinian corpuscle, which senses vibration. So, went through this. But many of our runners are going to run in shoes. So, how can we get around the fact that shoes block the skin on the bottom of the foot? And which footwear is going to be best for our runners? Research has shown that the more cushion you put in shoes, the impact forces of that runner actually goes up. The reason is that the cushion dampens and skews the body's perception of the vibration coming in. So your body thinks that there's less vibration coming in, so then you hit the ground a little bit harder. It blocks that reflexive response, which means there is a delay in how quickly your body can decelerate and load those impact forces. If we look at minimal footwear, whether it's a Vibram, a Free, a Minimus, a Huarache sandal, it doesn't matter. What you're doing is you're taking away the cushion, or you're decreasing that cushion, which will then increase the accuracy of the impact forces coming in, or your body's perception of the impact forces coming in. The more accurate the perception, the more accelerated or accurate the loading response is going to be. But you're still not fully tapping into the barefoot science aspect, which means we have to do what we call barefoot before shod. We have to train and stimulate the skin on the bottom of the foot, the reflexive response, and that reflexive stability before your runners start running. This should be in the beginning of all of their runs. And what you're doing is you're pretty much just priming the core so that it responds faster with foot contact. If you just change your footwear, or you just change the strike pattern, you're still going to see injuries. Midfoot strike running, or barefoot running, or minimal running, whatever you want to call it, still has very high injury risk. And the reason is because you have to train the skin on the bottom of the foot and that reflexive stability before you put on the shoes. So, real quick, I just wanted to show this because I know that there's a lot of argument on impact forces when you do a midfoot strike, heel strike, minimal shoes, high cushion shoes, etc. Impact forces are the same. So if you take someone who is running, let's say they're running in a Vibram, because there's actually a lot of research related to running in minimal shoes, and you have that runner running in a midfoot strike and then running in a heel strike, the impact forces are actually the same. So impact forces don't really change, so we can't totally blame the impact forces. So I don't want a misconception that the impact forces are bad. It's the body's response to the impact forces as why people are getting injured. So you have to train for those impact forces, and you have to just initiate that reflexive response faster. Impact forces is how your body gets the energy to take the next step. That is where you get the elastic energy. Any delay, that's where you're going to start getting injured. So, how do we put this all together? And this has to do with the movement prep. So, again, thinking about short foot, this is really what we're doing. So, every runner that's coming in, you want to teach them and incorporate barefoot stimulation into their program. They should be doing it several times a week as just a workout. I have my patients do 3 times a week for 30 minutes, and they're doing barefoot single leg exercises, sequences. When they start getting acclimated to it, you can start doing a lot of jumps, get some deceleration, higher impact forces, almost like a ballistic type movement with them barefoot when they build their endurance. Then every time they go for a run, this is how you want to prep them. You want them to start by doing single leg short foot. When they do this, what's really important, and a lot of these exercises are on the EBFA site and the back end of the portal, is that again, you're doing single leg, but you want to make sure that the knee is flexed. So if you're at home or you're somewhere that you can stand up, well, I'll kind of stand up right now and do the single leg position. So if you are standing up, and I'll stand up with you at home, is I want you to make sure that your standing leg is flexed. So you want to try and get like a 15-degree bend or flexion in your knee. When you flex your knee, we know that you need to flex at your hip versus keeping it straight down, because this is really how we load. Your body loads by flexing the hip and flexing the knee and dorsiflexing the ankle. So try to get into that little spring type position, okay? Another reason why you want to make sure that you're doing all of these exercises single leg with that knee flexed and that hip flexed is that when you activate short foot locks your subtalar joint, and it actually drives an external rotation spiral into your knee and into your hip. So it locks your knee and it locks your hip. So if you do these exercises on a single leg with your knee fully extended and your hip in a neutral position in relation to your torso, your runners or your clients and patients are going to experience knee pain. And I don't want them to get a false perception or a negative taste in their mouth about short foot and associating it to knee pain, because it's so beneficial. So please make sure that the knee is flexed so that you don't drive a locking mechanism onto a locked or extended knee. Okay, so I always have that flexion. And then you would just start by doing short foot. So you would find that little single leg position, find your short foot. When you're driving that big toe down into the ground, remember that you're getting a pelvic floor or a core co-activation. So really cue your runner, your client, to root down into the floor with short foot while picking up their pelvic floor. So they should feel an opposition happening. Foot down, pelvic floor up. Okay, holding that for 10 seconds, great. Move to the other side, do the 10 seconds, great. Go back to the right side. Now we're down to our single leg deadlift. And we're just going to keep going back, right to left, right to left. When you do that single leg deadlift, the short foot or the timing of short foot is important. So you want to do short foot on the bottom. So if you're at home, we'll get into our little single leg deadlift position. Okay, or it's kind of like a third warrior in yoga, is that you want to tip down, still keep your knee flexed. Okay, and then you're going to do short foot on the bottom when you are into that hip hinge or that eccentric load of your glutes. Short foot is on the bottom, and then you return back up to your start position while engaging your core as you return. So short foot is always on the bottom, or where you're going to kick in the concentric phase and then bring it back to your start position. 8 repetitions, right, left. Now we're down to our single leg squat. Same thing here. Single leg stance. Flex down to the bottom of the squat. When you're in the bottom of the squat, short foot on the bottom, kick in your core. You should feel your deep 6 kick in, and then press out of it while lifting the pelvic floor. Again, on the concentric, that's where you're kicking in short foot, bring it up. Great, perfect. Okay, now we're moving on to the left side. Great. Back to your right side, we're doing floor tap. Again, all of these exercises, so if you're not familiar with them, EBFA site and on the portal. Okay, so floor tap, touching the floor, short foot on the bottom, bring it up, right, left, bowler squat, kind of like a Y balance test. We want to get the transverse plane. You're going to engage short foot when that opposite leg is out in that reach position, and then bring it up. Side lunge, same thing, reverse lunge, back to that single leg rotational. This really is my program for runners before they even run. They're doing it barefoot. They're getting the foot and the core to work together. This is what's turning on all of that innate loading response and that reflexive stability. When they then put their shoes on, they are priming, or they just primed their nervous system to respond faster. Okay, and then integrating this into a workout, which is just going to further drive that motor programming. Okay, so in addition to that, what we're going to do for improving our runner efficiency Obviously, proper footwear. I try to encourage all of my runners to switch. If you are a heel strike runner and you wear minimal footwear, that is still fine. A lot of people, when they see people run and they're running in a minimal shoe and they're doing a heel strike, that's not necessarily bad, because a lot of people actually, if you do gait assessment or you watch people run and you film them, or if you don't do it, film your clients who say they run minimal or midfoot and just see. I guarantee you probably half of them are not doing a midfoot strike. And the reason is, but they think they are. The reason is that they're changing their gait with the minimal footwear. They're still doing a heel strike, but what they actually changed is the dorsiflexion angle of their ankle on initial contact, which actually decreases your impact forces. So if they've done that, their perception is that they changed their running pattern, and it's fine. They're not going to get hurt as long as they change that dorsiflexion angle on heel strike. Okay, so the more dorsiflex that your ankle is on heel strike, the higher your impact forces, which is why when runners overstride, the reason that they get injured when they overstride is because they have to dorsiflex their ankle more, and the impact forces become higher, and their body is not prepared for that degree of impact forces. So just watch the runners, go minimal. It's going to give them a more accurate perception of impact forces. And then again, if they do a heel strike when they're in a minimal shoe, totally fine, as long as they decrease that dorsiflexion angle and they bring their stride to be a little bit shorter. Okay. Intrinsic strengthening, right? So we just spoke about that. Those are whole innate loading response, foot to core activation, and single leg exercises or eccentric exercises, super critical. Third one that I integrate to all of my runners who are improving their efficiency has to do with the fascia. So they're doing myofascial release, because that's where we store our impact forces, and we need that viscosity to that tissue if we want to act like a little rubber band. If they have any injuries such as Achilles tendonitis or plantar fasciitis, I do use rock tape or a kinesiology tape, and that just adds a little bit of like a priming to their nervous system, and it takes the tension off of their fascia and their tendons. So it's really good for Achilles tendonitis, plantar fasciitis. It kind of turns things on a little bit faster. So again, this was focusing on step one. If you remember from the beginning that I had said that there's three things that I look at. We focused just on the innate loading response here. Other reasons of why your runners are getting injured is if they can initiate that loading response fast enough, but they can't control it, they're obviously still going to get injured. What controls that loading response is all your eccentrics, and is highly in the glutes. So the glute med, posterior fibers, glute max, superior fibers is what's controlling those impact forces eccentrically. And then fatigue, make sure they have eccentric endurance. And then the fourth one, which I didn't list on there, would have to go back to the fascia. So they need eccentric control, they need eccentric endurance, they need myofascial viscosity or flexibility, and they need reflexive stability, which is driven from the foot up. So if you have any questions, just type those in. Otherwise, I'll just start talking again. So type in any questions. Again, I use this with all of my runners, and I'm not overly concerned based on the strike pattern, whether it's a heel or a midfoot, because again, I see many minimal running shoes or actually true barefoot runners who are still striking their heel first. So not necessarily true. And with the myofascial work, is I want them to do that also before they start running. So really the runners, I want them to do just 5 minutes of quick myofascial release. If they have limited ankle joint mobility, I want them to do 5 minutes of trigger point release to the gastroc or the soleus. And then I'm having them activate the foot and the core barefoot, getting that reflexive sequencing to happen. And then they're putting on their shoes and they're running. and the risk of injury then is decreased because they're just responding a little bit faster. So any questions, you can type those in. Again, for the exercises, check out the EBFA YouTube channel. There's a couple barefoot balance exercises or workouts that have different sequences, which can be integrated not in the prep work or the warm-up, but more as part of their weekly routine. So they're doing it 3 times a week, 30 minutes, and it's really targeting why these runners are getting injured. So, all right. So question, do you incorporate this type of information in your barefoot rehab course? Absolutely. A lot of this is integrated, obviously a little bit deeper, but reflexive stability and the concept of reflexive stability is a large part of the Barefoot RX program. And the reason is that really people are getting injured. If you look at it from a rehab perspective, people are getting injured because they're not stabilizing fast enough. And we could ask many questions of why they're not stabilizing fast enough. And then if it's not reflexive stability or stability driven, it would then be inefficiency driven, which means they're just fatiguing too fast. So yes, this is very much integrated into the Barefoot RX, and it's actually related to research that I'm doing. I'm trying to see if just what I'm talking about here can actually decrease glute fatigue or offset glute fatigue, which has many applications, especially to the knee. So whether it's ACL injury risk, IT band, frontal plane, etc. So yes, absolutely. Do you give them much time between the myofascial release and the activation exercises? Since the release can inhibit muscle contraction. So super great question. The type of myofascial release that I want, if you're talking about myofascial release for efficiency and loading response, is just superficial. So I want them to be on the lightest foam roller or whatever they're using, to just roll over the superficial fascia and bring a viscosity to it versus doing the deeper release, which causes that inhibitory effect. If you are looking at doing the trigger point release to inhibit and increase ankle joint mobility, because all of these exercises are non-impact related and they're more static, I have not seen a opposite injury risk because you're inhibiting a muscle. So that would be because we're not going trigger point release and then go run. We're doing trigger point release and then, okay, let's start resetting activation patterns. Injury risk would be down because of that. But that's a great question. So you recommend not only the 5-minute barefoot prep before runs, but also the 30-minute 3 times a week barefoot training. Yes, absolutely. We know that runners love to run and not train in other ways. So part of their injury prevention program has to be something, some sort of toning program, and that's where I go at the single leg barefoot exercises because it's just really reinforcing eccentric efficiency and eccentric endurance. So yes, 100%, they can't just run to reduce their injury risk. Do you also recommend myofascial release for the anterior tib at the walks 3 mile point? Does that mean at the when they're running and then they walk? I'm kind of confused on the walk 3 mile point. But do I recommend myofascial release to the anterior tib? Not really. The only time that I recommend myofascial release to the anterior tibialis is if they have a overly high arched or supinated inverted foot, then yes, I will, because they're very rigid and locked down in that foot type. So I want to release that inverter. So I would go after soleus and tibialis anterior, specifically in an overly supinated, locked, high arched foot before they run. So because we know that foot type is not good at absorbing shock, we need it to chill out a little bit before they start running. Okay. Do you think the 5-minute barefoot prep would be beneficial in a team setting regardless of injury? Absolutely, 1000%. So it's the way that I encourage not just runners, but all sports. And this relates to talking to other sports and getting more like college elite type teams to see the benefit of barefoot movement prep. We've all kind of switched the way that we prep runners and athletes and clients. Everything is a little bit more dynamic, dynamic mobilization instead of static stretching, all of that. So it really fits into what you're probably already doing with your clients, runners, or athletes. So it's super easy to integrate. They can't just be barefoot though. You need to get them doing short foot and actually engaging the foot. So it's kind of kicking into the hip with the exercises versus them just being barefoot. Okay, so that's just a small detail. I have athletes who are prone to hamstring strains all the way into the glute. Would these innate responses be recommended? Yes, absolutely, you can with them. Part of why you see those injuries and specifically like an insertional, like a proximal insertional hamstring injury, means that those glutes are not really kicking in when they should be. So they're decelerating with their hamstrings versus their glutes. And what this whole foot to core or floor to core sequencing does is that it's tapping into the glutes and it's getting those glutes to fire a little bit more. It's setting the stability of the deep hip joint so that hamstring doesn't kick in. So absolutely, I would highly recommend it in them, and would be curious to see how they respond from your experience. So yes, I would include that. Okay. Do you add a flexibility program to their work since the literature is vague and its benefit to the injury prevention? I do. But the way that I recommend flexibility program, and this is kind of a little bit on my take and my experience with patients and how I interpret the research, is I always have them before they stretch, and there's still a benefit to static stretching, and many people are always going to static stretch anyway. But before you do that static stretch, can you inhibit certain muscles with myofascial work or trigger point release? You're kind of inhibiting a certain muscle, and then you're moving them through dynamic stretches or static stretches if they're super inclined to do that, and try to get a little bit more like a 3D triplanar, kind of like mimic. I think it's Gary Gray has the frame and does a lot of 3D stretching and stuff like that. But before you do the 3D mobility and follow the fascia line of where you would stretch per se, is I have them do the myofascial release. So they're doing myofascial release, dynamic 3D type full body stretching. And then they got to lock it in with some sort of activation, whether it's pelvic floor, deep six, short foot, something after they mobilize. That's the program that I do for their flexibility. So absolutely do integrate that. And we know it's highly focused on the anterior hip and the TFL and everything that's driving them into kind of that internal spiral is inhibiting the quads, inhibiting the TFL, and then start to drive a spiral up into the obliques and get those obliques to mobilize, and then seal it in with pelvic floor deep six short foot. And that's, a lot of people stretch until they turn blue or they foam roll their entire body. I think that's what most runners probably say that, and you guys can probably attest to that as well, is that you'll ask your runner, are you foam rolling, are you doing myofascial work? And they'll say every day, like, I'm doing my calves, my quads, I'm doing it till I turn blue, but it's not sticking or it's not working. So that's where I want them to add in after they do that myofascial work is the mobility, like move through your new range of motion now that you just inhibited muscles. And then when you move through that range of motion, you got to seal it in with some sort of activation. Otherwise, your body's going to fall right back into wherever it was before. So, absolutely. Great question. Is the eccentric loading response more important to women since they tend to be quad dominant? I would say everybody. It's important too. But yes, you could make that argument. And actually, the research I'm doing is I'm using female subjects, looking at the glute fatigue and the glute endurance, and how it relates to knees. So absolutely, you can add that element in there, and just emphasize the importance a little bit more for your female clients or female runners. But we know that the human body loads through one mechanism, and it's this innate response that involves flexion and internal spiraling. So obviously important for everybody, but yes, could absolutely include that. So another question, do you have any movement screening such as FMS prior to working with patients or clients? I don't do specifically FMS. I think it's a great assessment, and if you do it, I think that's awesome. In my office setting, I do both open chain, mobility to the foot, lower extremity, and then I do closed chain where I'm doing single leg stand, single leg squat, double leg squat. And then I watch them walk and I watch them run. Sometimes I will watch them do step ups and step downs. So I'm doing that. And then if it's sport specific and it involves anything lateral or jumping, I'm watching them do a step down from a higher level. So kind of like a single leg jump landing. So I'm looking at that. And so really what most of my movement screens that I look at, I try to capture how they're going to react to impact forces. So, and that's maybe the difference between what I'm using versus FMS is great, but I think that you still have to look at the way that the client, the runner, the patient responds to impact, because that's where your injury is, or most of your injuries are happening with the impact. So doesn't really have a name of what I'm doing, but it's both open and closed chain, and it's dynamic, namely walking, running, step up, step down, jump up, jump down. So yeah, absolutely. And that's a big thing, is that you want to see how your patients or clients respond to impact. And I think most movement screens kind of forget that's where people get injured, is like, what do they do? Like, can they respond fast enough? Can they control it? Do they know where the heck to put the impact forces when the body brings it in? So definitely try to add in a little bit dynamic in your movement screens if you aren't yet. And we have a course based around gait assessment, walking and running, and gauging how your client and athlete responds to impact forces. And if there's a delay, you can see it. You can see when your client or the runner is in mid stance and they're still decelerating. Huge sign. Either they can't control it, or they're loading, or they're not initiating it fast enough. And that's really what I'm looking for, is that the timing of that deceleration and the control. Okay. Do you incorporate speed of movement into your exercise program to make things more sport specific? Absolutely. Working with basketball players now to create specific barefoot movement prep for basketball players. Obviously, runners is sagittal, and it involves a specific foot strike if you're doing midfoot versus heel. So definitely can do that. But for different sports, 100%. You can go lateral, you can do a deceleration. Something that I like to do is a single leg jump, whether you're jumping off of something. So kind of thinking of a basketball player going for a shot, and then they're landing, and they're typically landing with a unilateral weight distribution. So I'm having them jump off of a box, land barefoot in a single leg, engage short foot. And then when they have it, they're going to take off and accelerate in the opposite direction. So you kind of think that they're landing and then they're accelerating away from the basketball court or whatever, or they're jumping off of a step, landing, and then you're going to throw something, throw a medicine ball at them, and then have them throw it back. So now they're teaching their body not to just stabilize in that single leg from the floor to the core, barefoot, short foot, but stabilize and then react. Whether that reaction is something coming at them or that reaction is accelerate in the other direction. And that's kind of the sport specific side of it, which is obviously fun to create programming like that. But yes, 100%, 100%. And I'll have to shoot a video and start showing some of those incorporations that we're doing with the different athletes. So, all right, absolutely. Any other questions? Ellen, you had some awesome questions today. You are on a roll. So thank you all for the questions, for tuning in. Okay, excellent. Thank you, Scott. All right, so if there are no further questions, then I will let you guys go. And again, if you want to listen to this again, please check out the YouTube channel. If you want a locked version of the PowerPoint, just email me, education@ebfafitness.com. I know certain facilities do in-house education and they'll do like listen to a webinar as a group. So I have no problem sending out locked PowerPoints if you want to review it, keep it on file, print it, read it, etc. Please stay tuned for our future webinars, first Thursday of every month. And if you have not attended an EBFA workshop yet, I would love to see you in one. We have many workshops going around the country, and we are in 6 different languages, so very exciting as well. Okay, have a wonderful night, and if it is your day, I know there's some people from Asia who are tuned in, have an awesome day. Thank you guys so much.